Hello, and thanks for tuning in. My name is Nathan, and I'm a student in the Physical Therapist Assistant Program at Whatcom Community College. Joining me is Trevor Ledain, PT, from Performance Physical Therapy here in Bellingham. Thanks for being here, Trevor.
Yeah, no problem. Glad to be here.
Excellent. Before we get into the questions, could you just tell us a little bit more about yourself?
I became a physical therapist in 2006. Got my doctorate at the University of Montana in Missoula. My undergrad was in the University of Wollongong in Australia, New South Wales. Bachelor of Science, Physiology, Rehabilitation. Worked at cardiac rehab a little bit in Sydney, and then that was earlier. That was 2003, 2004, and then did the 3-year program in Missoula and became a doctor of PT in 2006.
That sounds really interesting, for sure. Well, I asked you to join me today to share your experiences with physical therapy as a telehealth service. Performance has been doing telehealth since late March, and I'm sure you guys have learned a ton since then. And I'm wondering, in your experience, what kind of patients are well suited for telehealth physical therapy?
So I've had cervical, knee, shoulder, cervical, some thoracic in there as well. Everyone did really well. You need a reliable internet connection, but even I had a knee patient from Glacier. It's not known for its reliable internet. They did fine. All age groups, so 73. I'm not sure if that's my oldest. Maybe I think that's someone in their 80s too. But so it's not really it's not age related at all. You have to be comfortable with technology, with Skype and FaceTime and everyone's pretty, and Zoom. Everyone's pretty comfortable with it now. So it worked out really, really well.
Well, that's very cool, for sure. And I know Performance has reopened recently with all the safety precautions and protocols in place and everything. But for someone who's still considering making a telehealth visit, do you have any tips or advice for them to maximize that experience?
Have a good space, and then a space that you can place your either laptop or device ways away from you, and that you're well centered in the screen, so that we can see the whole body when you do movements. Well lit. But that's pretty much it. We make things work on the fly too. So we do a lot of adaptation as the treatment session goes on, just to make it work.
Well, that is very cool, for sure.
Appropriate, like an in-house session too. You want to have appropriate clothing. So if it's a knee, watching the kneecap, bony landmarks are important to see. So your malleoli, your patella, your hip, so shorts, and then because what you can do pretty easily and maybe even more accurately than a goniometer is you can go do goniometric measurements and with freezing, so you can take a screenshot, and then we have an app that you just place dots on the bony landmarks, and the app takes the measurement of shoulder flexion, knee flexion, whatever you want to measure.
Oh, that's really cool. Had you used that before, or was that a first new experience for you?
Yeah, that was new. Yeah,
that's pretty cool.
Yeah. Like I said, it's like technology. It's so fast. You can go, right in from DoxyMe. So that's the app we use for the meetings. It's HIPAA compliant, but you can bounce from DoxyMe to the App Store, grab yourself a angle measurement tool and whatever you need, and slow motion tool for video analysis, and then bounce back. And so we had, as practitioners, we had used a lot of, we were our fake clients, and before for about a week, 2 week, week and a half before seeing real patients. So we had all this in our, so what happens if we have a shoulder and we got to measure range of motion improvements, and then so we had all our tools prior to seeing real patients, but it was easy as we were doing these test visits to quickly bounce in and out of doxing me into the store and grab what tools we needed.
That's very cool. How has your clinic addressed the inherent safety and liability concerns with the telehealth visits, as far as like you not actually being there in case of falls, that kind of thing?
Yeah, you have to consent to a treatment, telehealth treatment. And I didn't see anyone that I was concerned about falls with. But the biggest thing is consent to treat. So they consented to be treated by telehealth. And then using the appropriate apps that maintain their privacy and have strict protocols for HIPAA protocols, such as doxing me.
Cool. Well, aside from not being able to physically work with a patient, what has been the most challenging aspect of the telehealth experience?
Yeah, I think the not having hands-on is the most challenging. There are, some cases we do want to do some joint mobilization. So what's not challenging is viewing progress, biomechanical evaluation, because that's not challenging because you can do video analysis. You can even slow-mo it if you need to. If they're not able to do the motion in slow motion because of pain, or at a tempo or frequency that allows you to see it, you can slow-mo the footage after. So that's not a challenge. But I think the biggest challenge is if you do see, especially for cervical treatments, you do joint mobilizations and specific joint mobilizations, blocking segments above and below out, that we obviously can't do. And so you adapt the home exercise program to do self-mobilization, and you teach the patient how to lock the joint above and below out before they do their self-mobilization. Sometimes it's rough if it's the first time. If you're a patient and you're like, how do I lock my thoracic spine out? So that would be a challenge.
Yeah, for sure. How about the most rewarding aspect?
Oh yeah, getting to DC patients, just like in the clinic, really. And yeah, someone had my knee guy move from here to his home in Winthrop, Twisp, and he got to add mountain biking to his program. And yeah, he huge gains, and he had his own. I think here he was like living at a friend's house or something, and then he had his own equipment there, so he was able to be more compliant with his home exercise program. And yeah, so anytime you get to DC a patient and see them get back to work, in this case, he also got back to work too, as well as back to his recreation pursuits. It's super rewarding.
Yeah, absolutely. Let's see. Well, can you share something surprising that you have learned during this experience as a telehealth physical therapist?
Yeah, I was super skeptical, and I think, and then that patient from Twisp, he was, equally. Most of my patients were pretty skeptical about it. I had 2 or 3 super keen about starting it, and then the rest were pretty skeptical, as I was myself. And then just how effective it was. And then almost, like I say, the measurements, the range of motion measurements were maybe even more accurate than with a goniometer in the clinic, just as fast. I really enjoyed the experimentation and then the adaptation that was required in a lot of cases to assist patients in with cueing for home exercise programs and assisting them with like their self mobilizations and stuff. So that was fun. I added a little twist to the thinking, a little more, yeah, another twist to the adventure.
Yeah, that's so cool. Well, those are all the questions I had for you today. I really appreciate you being here and sharing with me. That was a really cool, really enlightening experience, and I feel more educated now and feeling pretty confident about the telehealth in case, it has to continue or we have to do it again in the future.
Yeah, well, we'll definitely continue it. Medicare now covers it, and I can definitely, even if we get a vaccine, I can see it being more an advantage financially for individuals that have transportation issues. So we're definitely continue it from now till forever. So regardless of what pandemic or epidemic is in place. So yeah, get comfortable with it and practice on your colleagues and yeah, you'll be pretty surprised at how fun, effective it can be.
Well, thanks again. I really appreciate it. Stay safe and be well.
All right, you too, Nathan.
Thanks.
Yeah.